Lung disease is an invisible disease per se. You know, nobody knows you have it unless they see you exercise. So really nobody knew I had lung disease except my close family for a long time. First symptoms were I was in the Martin Luther King pool downtown training for the, I think it's called the Big Splash or something. It's a 2-mile swim in the Cooper River. And it was a springtime 2007. And I remember toward the end of the training, it was like a 6-week training with a great instructor teaching you how to swim better and everything, and tons of people, and we were all swimming laps. The very last session, I had trouble keeping up. And I had to actually move out of my lane to a very slow lane. And I never knew this was what was coming. It just was, wow, I can't breathe tonight.
It's a very scary, it was huge news that I think so often you face an illness and there's always a part of you that believes you're going to be able to conquer it, or that you'll heal, or that you hold out some hope.
It's just a very rare form of rheumatoid arthritis that can infect any organ, and mine infected the lungs. And I guess it calcifies what happens in your joints actually begins to happen in your lungs, where it's an autoimmune disease that begins to attack your lungs. And in my case, the fibrosis started on my heart and lung side, and it would begin to attack calcify where the alveoli is. And so you slowly begin the ability, the area to breathe, not only volume-wise through fibrosis, but the ability to convert the oxygen to your blood through the alveoli. So essentially mine first started attacking the left side and eventually came over to the right side.
It's so hard to watch someone not have enough breath and not have enough oxygen.
So the morning that things got bad, it was a surprise because I was doing fine the day before on my oxygen, just taking it really slowly and knowing that I was waiting for the call. I'd been on the list for 14 days, so you're sleeping with your phone, you got special ringers on, you're just kind of hanging out waiting for a transplant call.
He was admitted to the MICU where we spent a very long night with a lot of breathing difficulties. And in the morning when Dr. Whelan and Ann and Jason came over to round, I was outside of Lorcan's room and just said to them it was a very bad night, which Whelan had known about. And he looked at me and he said, "How would you like to get new lungs today?"
Came out of operation Friday morning at 4 a.m. or 3 a.m. And I believe the following, and 24 hours later, they took me out, the tube out. And I remember coughing maybe for 4 or 5 seconds and being fine, smiling that I was breathing.
Being here is the fact that the medical university has opened up a lung transplant program is absolutely a godsend.
I felt I'd get the best quality at a program that was focused, on less on numbers and more on outcome. This is what I felt the program here was about.
The key to a good outcome, no matter where you decide to go, is having faith in your medical team. There is no question in my mind that MUSC has the transplant expertise, as evidenced by a very successful heart transplant program, liver program, pancreas program, kidney program, and bone marrow transplant program. The lung program just adds to that expertise. MUSC has successfully recruited the physicians and surgeons necessary to make this successful.
Just a phenomenal care in terms of that. And Dr. Denlinger's, his final words to me were, "Have a great life." When he looked at how well I'd healed, he was like, "We'll see you on the streets somewhere of Charleston. Have a great life."